Yeah, I mean, it's still numb here, but, like I know that's normal. And I was just telling them out, before I came back, until about week 6, it's kind of like you're always conscious of that numbness because it just is pretty numb, like even when you're trying to talk on the phone or whatever. Now I'm really only conscious of it if I touch it or I'm applying makeup. Other than that, you kind of forget about it. I did a lot of research online and I really wasn't able to find anything that showed a day-by-day progression to really be prepared for what the healing process looked like. I was always able to find before pictures and after pictures, but I wasn't able to find something that gave me kind of a chronological day-by-day recovery process. I did not share with my family other than my kids, my 2 daughters. I did share with them what I was thinking about, but as far as the rest of my family, I did not share with them. And in fact, they live out of town, so I still haven't shared with them. I'm kind of waiting until I see them in person to see if they notice any changes and ask me anything about it. So really, as far as family goes, it was just my 2 daughters that I shared anything with. So my daughter that turned 16 today, when I came home, she had a lot of concerns for how I looked. At first, the very first couple of days, I think she expected me to look really distorted and kind of rough. But I don't think she expected, like 1 week and 2 weeks out to still really have kind of that alien look. And I'll be honest, it was difficult for myself as well. I think I knew it was just a matter of time though, but for her, I think she just kept thinking, you don't look like my mom anymore. But now she thinks I look fantastic, and she's completely fine with it. It really didn't last a long time, her anxiety, I guess, because then we kind of made light of it and it just became kind of a joke. But it was a little bit rough on her for a couple of days there. So I think the first time where I felt a big jump in the relief was when I got the sutures out. So that was on day 7, I believe. Until then, you really don't realize how much that's kind of additionally giving that pulling sensation and some discomfort. So I think day 7 was one day where that made a big difference for me. Day 14, I think 2 weeks out, that's kind of when I returned kind of my public appearance, if you will. So that was another big day where I felt like, okay, at least I can be a little bit more normal and get back out and, into the public, even though I still felt very self-conscious. For me, I think the biggest where I kind of felt like this is really starting to look really good was a lot longer than I thought. It was really about week 5 going into week 6 where I felt like things really started to even out, as far as this side seemed to be healing more slowly than my left side. So I kept feeling like there was some distortion, even when I smiled and things. So it was really about week 5 going into week 6 where I felt like everything started to even out, soften up as far as kind of the firmness. There is still some firmness and some numbness, but that's where I felt like things started to soften and really become more symmetrical and settle into place for what I would say is the final result. So the morning of the procedure, when I came in, I remember feeling just a little bit anxious. Of course, I think anytime you're going to have something done, you feel a little bit anxious, but I wasn't worried about any type of pain, if that makes sense. I think the biggest thing I was concerned about was that I was going to be awake for the procedure. So when I came in, they brought me back, I, changed. They gave me 20 milligrams of Valium, and I remember just kind of sitting there. They're like, we're just going to kind of, let this work for a little bit. And then when they came back in, they said, how are you feeling? And I do remember then, like as I was sitting there, getting a little bit more anxious. And when she asked about how I was feeling, I said, well, I still know everything that you're saying. And she, am I going to feel, I was kind of nervous about, am I going to feel something? My biggest concern was not pain, but somebody coming at my eye. That was really my biggest concern because we were doing the upper bleph. So I was worried about I don't like things coming at my eyes, so I was worried about panicking or being jumpy. So she did give me another 10 milligrams because, you know, I was a little bit nervous. So honestly, you know, I mean, and then I remember walking back to the chair, getting in the chair. Even though he did the upper bleph first, I have zero recollection of the upper bleph. I remember none of that. And then he did the left side, and that's the side that is on the video. The only thing I remember about that is I do remember when they were doing the liposuction here, I could feel some tugging, but I couldn't feel any pain. And I remember thinking, ooh, this is weird. And then when he was doing this side, I can remember hearing him talk because he was explaining to the camera. And I remember, the only thing I can really remember, zero pain. I can remember when he would have to cauterize, I could hear that, you know, that zapping and kind of, you know, smelling something that was a little bit off, but I couldn't feel any pain whatsoever. So the day after I actually drove myself, I was fine to drive myself, and even just getting that head dressing off, that, you know, that was a big relief because, you know, they've got those, you know, the big bandages around your ears and, you know, the wrap on there. And it does just, it makes it a little bit sore, you know, when that's all on there. So I think after getting that off and getting cleaned up, you do go home and you feel a whole lot better after getting all that off that first day. I would say 3 tips would be, first of all, understand that it's a process. I was really conscious of wearing the chin strap as much as possible to kind of keep that swelling down. Sleeping elevated. I slept completely inclined. So sleeping elevated. Another thing that I really did was I hydrated probably double what I normally would hydrate. I think the hydration helps a lot. I didn't have a lot of pain, so I really don't think there's preparation as far as, you know, making sure that you can tolerate pain or anything like that. It really wasn't painful. I think one of the biggest things is it really does mess with you emotionally because you're looking in the mirror and you kind of go through this roller coaster of, oh my goodness, what have I done? And you have an anxiety of, am I gonna look normal when this is all said and done? Am I gonna look better or am I gonna have regrets? So I think just constantly reminding yourself that it's a long process, and Dr. Mendelsohn knows what he's doing. He's done tons of these, and he's fantastic with putting your mind at ease. I did communicate with him a lot on those first 7 days, really probably the first 2, even 4 weeks. I made known to him all my concerns, and he's fantastic with this is normal and putting you at ease for what's to come.
And you're still healing, right?
Oh yeah, yeah. So I still, we're 7 weeks out. There's still numbness here, and it's still firm. It's still very firm. But it's not something that you're conscious of 24/7. It was probably up through week 5 going into week 6 where I was conscious of it. You know, you can just kind of sense that you're numb there, kind of like coming home from the dentist where you feel like maybe you have a fat lip. So you kind of feel full here, even though you're looking at yourself and you don't look full, it still feels full. So now I'm really only conscious of it if I'm physically touching it or applying makeup.
Well,
That is, I love being able to get this out to other people and let them know what to expect. Because like I said, when I was doing my research, I couldn't find anything of a day by day. All I kept finding was information on, you know, like before and then after, but even the afters were about this point after. It wasn't even that, you know, that 1 week after, that 2 weeks after. That's the tough part. So I think being able to share a day-by-day process so that that information is out there and people know what to expect, that's huge for me. I mean, I'm so happy to be able to do that for somebody else because it was something that I looked for and couldn't find. And honestly, I mean, it's definitely education that's lacking out there. And I thought I knew what my recovery was going to be, and it wasn't that at all. So I'm happy to be able to document that for other people so that as they're going through it, maybe I can eliminate some of that anxiety or that regret or fear that they have when they're 2 days out, 7 days out, and they're looking at themselves going, what have I done? And having that fear because I was there and I didn't have something I could refer to or someone I could refer to and go, this is going to be fine. I just had to live through that anxiety for, those 3, 4. For me, like I said, it was still 5 weeks where I was like, I look good, but I'm like, I'm not 100% like there yet. So I'm happy to be able to share that for other people and help them through the process. I would just say that if you're thinking about doing it and you keep saying, I'm going to put it off for, and then you've got your age or your number or, some reason that you're putting it off, don't put it off. Because that was me. I'm not going to do this until I'm 55. And then I'm so thankful that I did it now because I'll be 53 in October, but I'm like, you look in the mirror every day, and if you're looking in the mirror, or I didn't want anybody to post pictures of me online. My kids would take pictures and I was always like, don't put that online. So don't wait. Go ahead and do it for yourself now. It's worth it.
Awesome. Thank you so much.
You're welcome.
You look great.
Thanks. So, I mean, I feel good. And like I said, if you would have brought me in even 3 weeks ago, I think I would have said like, I don't know if I'm ready to, let's wait a little bit longer. So, and, I mean, I think it's even going to, I think it's going to get better even in another month because there's still tightness and numbness here. And one thing that I guess I didn't mention this, it was just something that was kind of weird for me that I didn't notice. I kept thinking like...
Go ahead, you face me.
Yeah. Oh,
yeah, go ahead.
So one thing I didn't think about was I always had really big dimples. And I kept not being able to pinpoint my finger on why is my smile not right? And I kept, in the mirror as I'm trying to smile and you're trying to get that back and there is some asymmetry and that's a struggle. And then when it started to even out, I was like, something just doesn't look like me. And what I realized was my dimples were gone. So I actually Googled to see after a SMAS lift, do you lose your dimples? And for the most part, it says, over time, they do come back. And oddly enough, I don't know if I smile real big now, you can see they are kind of starting to come back. So, that was something that it never even crossed my mind. But I knew something, I was like, something's just so different. And even with the, the more youthful, and I even looked back at pictures of myself when I was younger or whatever, and that's where it kind of hit me because when I was younger and my face was even fuller like it is now, the dimples were really, really accentuated. So that was kind of different for me too, that's it, that my dimples are gone. So.
That's awesome. I see them now.
Yep, they're coming back.
That's awesome.
Yep. So, but it was funny because I was like, I couldn't pinpoint it. I was like, what? Even with something so different. And then I was like, it's my dimples. I don't have dimples anymore. And then I was kind of like, oh, I don't have dimples anymore. And so I Googled it, and it was like, for the most part, they'll kind of, they'll come back. So.
How's it been down at the lake with the sun and everything?
Yeah, I mean, I'm really good about sunscreen or whatever, but I mean, I still probably, you can see I clearly have a tan, but,
But you look great.
Yeah, I mean, I keep the sunglasses on or whatever, but I usually use, and I don't know if it matters putting several layers on, but I mean, everything I put on my face has sunscreen in it, so, but,
Well, you look awesome.
Well, thank you.
Congratulations on that.
I guess you need all the, does he need me to be?
Let me
okay.
just hang tight for a second because I think we're going to have to turn the cameras off. I'll be right
Okay,
back.
sure.